April 25th marks World Malaria Day, and the theme for this year is harnessing innovation to reduce the malaria disease burden and save lives. The World Health Organization has called for the urgent scaling up of innovation and deployment of new tools in the fight against the disease, while also highlighting malaria's devastating impact on families, communities and societal development, especially in Sub-Saharan Africa. Here to talk to us more on this, I'm joined by University of Cape Town Professor of Clinical Pharmacology, Karen Barnes. Prof, good evening and thank you very much for your time.
Good evening. Thank you for inviting me.
Are we deploying technology nearly quick enough to be able to assist us and help us in the fight against this disease?
It's a good question, yes and no. I think that there are lots of tools and resources available for us that weren't available 20 years ago. But of course, to deploy them successfully requires the commitment and cooperation of not just the malaria programs, but communities themselves and healthcare workers. And as one gets closer and closer to malaria elimination, it's easy for people to focus on things other than malaria, and that can make it really hard to achieve the high levels of coverage with the malaria tools and resources we have.
What we have, of course, seen with the pandemic is that governments, when they put their mind to it, they are able really to galvanize communities, resources, etc., and focus on ending a particular pandemic. Do you feel there's the same degree of energy that is being put towards this disease?
Sadly not, but I don't think it's realistic for so much focus to be placed on one disease when our communities carry the burden of lots of diseases. And so for something relatively short term, like Ebola or hopefully the COVID pandemic, I think that governments can divert resources or do divert resources. But something as long term as malaria that's been with us for over a century, over many centuries, it's, I think, important that the tools and resources we put in place are sustainable. We can't do it for 1 year and then not the next year, because malaria is a resilient parasite. Mosquitoes that transmit malaria are pretty hardy and they'll bounce right back the first day we take our foot off the pedal. So I think that what we need for malaria elimination is sustained commitment and effective deployment with effective health systems and community participation and buy-in.
Yeah. South Africa missed its target, of course, in 2018, more than likely going to miss that target again to eliminate malaria. But if you look at the cases, in 2020, South Africa had 8,126 cases and 38 deaths as compared to an estimated 10 or so million in the region and 23,000 deaths. Do you think the low number of cases could be a contributing factor in us continuing to miss this target?
I think that as you get closer to the elimination target, countries across the world have shown that it's those last few cases that are the hardest to eliminate. You have to have a really strong health system. You need a strong surveillance system. And, of course, community participation, when malaria is no longer a major burden in the community, is much harder to achieve. People don't necessarily want to have their households sprayed when they haven't seen any one of their neighbors with malaria for 10 or 20 years. People's willingness to seek treatment for malaria within 24 hours is hard to achieve when the chances of it being malaria are much lower than the chances of it being a number of other illnesses that have similar symptoms, like flu, like COVID. And so as we get closer to elimination, in a way our success makes it harder to achieve the elimination target. So I think a lot of people with experience in the field wouldn't set such short-term goals as we can achieve this in only 5 years. I think that we know that we've made great progress. We had over 60,000 malaria cases in South Africa at the turn of the century. Last year we only had 5,800 or so cases. So we have made great progress, but I think the realists in us, and particularly the awareness of the many challenges that the last few years have burdened our health system with, it's not surprising that it will take longer than we will like, but that doesn't mean we're not getting there.
Yeah. Speaking of challenges that we would have to deal with, particularly in dealing with this disease, one, there have been reports of resistance to frontline malaria drugs confirmed in Africa. There's also been the resistance to insecticide in mosquitoes, alarming signs, many are saying. Talk to us about the development of the human genetics and malaria resistance, and what are those challenges?
Great question, and I think it's one of the most important challenges we face at the moment. As quickly as we as humans are innovating in our efforts to control and eliminate malaria, the malaria parasite is evolving to avoid the mechanisms of the medicines that we have to treat and prevent malaria. And for quite a long time, we've been relatively spared in Africa. And now these resistant parasites have been confirmed in a number of countries across Africa. And that means we really have to up our game in surveillance, monitoring for that resistance, and in terms of our treatment policies to make sure that we're always ahead of the parasite and make sure that everyone gets totally effective treatment. The same goes for the malaria transmitting mosquito. And it's evolved clever ways of avoiding the insecticide that we use on the households in malaria endemic areas, and on the bed nets we encourage people to sleep under. And so I think that justifies why the World Health Organization has chosen its theme for this year's World Malaria Day to be innovation, because we've got brilliant researchers and we have great efforts happening to mean that these resistant parasites and resistant mosquitoes will have tools and resources that can overcome that resistance. But we need a strong health system to make sure that we don't get caught lagging behind the ability of the parasite and the mosquito to develop resistance.
Professor Karen Barnes, appreciate you. Thank you very much for your intervention tonight here on In Focus. The University of Cape Town Professor of Clinical Pharmacology there, Karen Barnes.